Hello everyone, this is Dr. Gavin. I'm from Spain, based in Dubai, oral maxillofacial surgeon, and working in King's College Hospital and Gargas Hospital in Dubai, both of them. Well, I'm here because I have a special concern, what is named tinnitus or ear ringing. So many people they have. It's a very suffering condition, really ruins the life of so many people. And the most important, no one knows, is a solution. I have a solution. I work on that, I investigate, I'm treating patients for that. You patients, you go to ENT, what is the most natural thing? Go to ENT, it's attached to the ear, it's in the ear. But the ENT, unfortunately, cannot provide any solution. Medicine doesn't work, no any treatment, no any surgery. But yes, what I do, because I investigate and discover that this tinnitus, this ear ringing, is connected what is named here temporomandibular joint. Here in this model, here is where is coming inside this depression. Here is the joint. So what happened? The proximity of the joint with the ear is the one condition this noise. Why? Now, if we see or you watch in my jaw, because when we have a facial asymmetry, not everyone is asymmetric. Many we are asymmetric. When someone has a rhombite and shifting the jaw to one side. With someone, because of this asymmetry between the upper maxilla, lower maxilla, our teeth are too prominent upper and too back lower, and maybe also the overbite of the teeth. We are in overbite. All these conditions, what? Look at my hand. The jaw is pulled back and counter-rotated, which immediately is creating a push-up here in the ear. There is an anatomical connection, small, very tiny ligaments and muscles in between the ear and the temporomandibular joint, which are conditioned and stressed because of the clenching, because of the change in the position of the jaw, the backwards, and the push-up. This is the critical point, the key for the treatment. That provides automatically what is the treatment? The opposite. Pull the jaw down and forward. Release the push-up. But before, we have to do something inside the joint. Why? Because it's a damage. Because also many people is connected. They have problems in the joint. They don't know. They have dislocations. They have wrong asymmetry, as I mentioned before. They have rhombite. They don't know. Unconditioned, a damage in the joint, and because this damage in the joint, because the proximity, because of the connection anatomical ligaments and muscles, affects the ear and is causing this problem. How to treat it? First, we need hospital. It's a matter of hospital, not a matter of small clinics. Then after, we need you under general anesthesia, full sedated, full asleep. Why? First, because it's fully safe. In those days, I did myself last year 2 times in my life, maybe 7, 8 times. I'm here still alive. Nothing happened. All days the anesthetics are excellent, the medicines are excellent, and you recover in 1 hour fully safe. For thousands of procedures, nothing happened. This is the first important, safety. The second, why? Because I need you fully relaxing the muscles. The anesthesia provides relaxation in the muscle because I have to go. First, I have to reposition, to realign the jaw and the joint. I have to do with my hand kind of maneuvers to release all this tension. This is critical. Then after, yes, we contribute with some Botox injection in the muscles. But Botox is only small amounts and you have to do where to place, and it's not by itself alone an effective treatment. Then after, we have to do things inside. But things inside is like a dressing. We have to inject some medicaments to regenerate, to relax the anatomical structures inside the joint with these small needles, minimal, no cut, no stitching, in, out, no scars. Like any injection, you go to emergency for a pain, you need to be injected medicines in your boot, injection, anyone is exposed to needles and nothing happens. And then finally, also we have to provide something more inside the joint. We go inside, we apply this small pin inside. Oh, the pin, who is the pin? I cannot feel. Okay, a small pin inside, and after with this appliance, then after we apply inside some waves. We use high-tech instruments also to provide some resonance and some high waves inside the joint to provide this benefit and this relaxation of these internal muscles and ligaments. And then finally, we play like a physiotherapy. We have to do a physiotherapy the patient after. How we do this physiotherapy? Thanks to this one I invented. So then we preposition, we know how to drive, how to guide a new position, convenient position for the jaw in the rehabilitation. You have to think that we need a rehabilitation as any medical procedure. After it's a rehabilitation, also we use this kind of splints inside the mouth to increase the vertical dimension and to push down the jaw. Remember I told the push up, the contraction, the spasm in the muscle is part of the problem. And also this small splint helps to pull forward the jaw. For the same I explained before. And finally, critical, because we have to maintain you in the good, in the betterment, because nothing is going to change in your physiognomy, in your anatomy, in your bite. And of course, you will continue cleansing. Many patients say, I don't cleanse. Yes, I cleanse, only I have to see your face, how this muscle here become bigger, and bigger. And more you cleanse, observe my face, more you pull back the position of the jaw. Even some of you feel like a discomfort, tension here in the throat, in the neck, and also when you swallow, so you feel like a pain, like a discomfort. So for that, I invent this system to be used in the night. It's double system, it's connected by this hinge, can be engaged and disengaged, and thanks to this hinge, then we pull the position of the jaw in millimeters down and forward. And provides you in the night benefit, better sleep, no tension. It's a compensation. Imagine sample for legs longer, one another people they need a heel. So, okay, we need a compensation in the night. And then finally, you will feel slowly. You have to be patient. Tinnitus is a difficult condition to suffer in your life and also to be treated. And being patient, being disciplined, determined, doing exercises, all the protocol I will teach you, slowly you will get better. Understanding that for tinnitus, if we score in a chart 1 to 10, imagine you have 7. If after the treatment you reduce to 4, for you is a lot. It's so much. You will feel big difference in your life. Or imagine you have bilateral, both sides. In one is quite much better, and another is better. So well, also the bilaterality, the both sides of one size condition. So it's very individualistic response, it's a slow response, but really with little improvement, big you change your life. Thank you for coming.